I was diagnosed in 2008. It's now 2014. So it's a mind warp when you. I was a relatively young person, 53, I think, when I was diagnosed, and it's it kind of pulls the rug out from under you. Because people don't know what it is, but people generally don't ask. If somebody asks, I treat it as an opportunity to inform people of Parkinson's and what options there are. Because what I found is people who talk to you about it, everybody knows somebody, pretty much. It's not the most common thing. A lot of people get it confused with Alzheimer's, but any opportunity you can take to educate people about that disease or any physical affliction is good. It removes the mystery and the scariness of it. A lot of people just clam up when you tell me I have Parkinson's. They don't know how to act. They kind of freak out a little bit. Balance, motion, even walking. I was having, dragging a foot. Through various people I've been able to work with, people down in Barrow, Muhammad Ali Parkinson Center, DBS, deep brain stimulation. I'm not a big fan of being surgically repaired. I had back surgery and it helped to some extent, but anything that you can do that's non-invasive is good. And I think this is a powerful way to go. I think it's probably something that could be of help to not only Parkinson's patients, but other patients with physical symptoms that need to be worked out. And as an adjunct therapy, I think it's a very good option. Again, it's non-invasive, and with a little practice, it's very easy to do things that you normally would do. And again, I've seen some increase in mobility, and that's an important thing because it is a chronic disease, and any slowing down that you can do of this physical symptoms is a blessing. I've had more energy level lately, been able to get more sleep, good sleep, and that's relates to less fatigue. So, and what I find is when I, kind of force myself to do things like yard work and stuff like that, it actually adds to the energy level than detract, which is hard to believe when it's 110 out here in Phoenix after something. But so I would say there's been an increase. One of the medications I was on, trihexidine, I think it is, we cut back on that in half from 2 milligrams a day, 3 times a day, I should say, to 1 milligram 3 times a day. And it's been a steady cut. We haven't had to go back to it. So that's definitely an advantage, all the stuff has to be processed through your liver, so the less meds you can take, the better. You know, I'm open to different modalities, and I hope anybody that earshot of this video would be open to that as well, because I think you have to treat the whole person. Well, he was a fellow working under the care of a doctor I had there, and he said to me in front of the other doctor that had I not known you had Parkinson's, I would have never guessed, you know, just talking out on the street or something like that. My name is Christopher Goff. I'm a patient of Dr. Kukurin's, and I authorize the use of this video for whatever they need it for.